2 years before the COVID-19 pandemic, I happened to visit a health facility in one of our client countries in East Africa. I vividly remember it was a bright sunny day and there were many solar panels installed outside the health facility. But guess what? As soon as I entered the health facility, I found it to be dark and realized that the equipment were non-functional. When I checked with the local authorities, I was told that there was no electricity and that the solar panels and inverters were non-functional. The authorities had lodged a complaint with the central line ministries, but no action had been taken. This made me learn one very important point regarding electrification of public institutions such as schools and health centers. If we just install solar assets and do not adequately operate and maintain them, then those assets are of little value. We must not focus on the installation of equipment, but instead focus on the service delivered.
When electricity fails, several health services are no longer able to be offered, such as vaccinations that are kept in cold chain equipment and oxygen for pneumonia.
Mimi naitwa Mwanasha Omari, mama yake Mariam Hassan Mnyeto. Nimekuja hapa hospitali kujifungua, alikuwa shida zake. Masikio yake hayasikii vizuri na hajielewi vizuri, nikamleta hapa hospitali tukaja usiku. Shida imekuwa pale akaanza kusukuma taa za waka. Lakini akaanza kusukuma taa zikazima. Kawa sola imemaliza moto. Kabidi washe simu. Azae na simu.
We cannot overemphasize the need of basic lighting in a facility. So if, say, a lighting system failed, then for a health worker, it's a nightmare. When power goes off in a facility, there is total disorder in most of the cases because they are not able to go around, they are not able to do basic things. And for a facility, if it is at night, then it becomes very difficult for even the patients to come.
For 4 years we were quite okay, and then something went wrong with the batteries. So when he checked, he said the batteries had gotten finished and they needed to be replaced. The maintenance should be done by the people who have installed it. It's very important.
Sola kwa sasa hii inamsaidia mtoto wangu pale pakubwa sana. Mitambo ikiharibika itaharibu masomo ya wanafunzi karibu wote. Si wangu peke yake, wote. Maana hizo madarasa zote hizo tunatumia sola. Sasa ikiharibika tumeathirika pakubwa sana. Kama sasa hizi masomo ya CBC wanatumia kompyuta. Na kama si sola ingekuwa sisi tumefail na masomo. Maana waje tuliambiwa ni ya pengine ikiharibika sisi tushughulikie. Pia ningeleomba kama itawezekana pia watushughulikie mpaka dakika ya mwisho kuhusu sola. Hapa shule sitoke na sola, maana imetusaidia pakubwa sana.
Long-term maintenance of the systems after they've been installed has been in question. So we need to understand better models on how to provide the long-term operation and maintenance so that these systems continuously provide the services that are required over a long time and they're able to function. And this entails building the capacities of health people, education people, in a way that they're able to maintain these facilities, embed in them the capacity, the technical people that are needed to adequately service the systems.
long-term replacement of parts, operation and maintenance. I think these are critical challenges, not only for schools, but also for remote healthcare facilities. They have very limited capacity to make sure that the operation and maintenance contract with the service provider is long-term. So that's why you will see in remote areas, in rural areas, many solar systems failing after the first 2 to 3 years and not being replaced.
I think I'd say sustainability is one of the biggest challenges we have with solar system installations, especially in public facilities. And to be honest, I think it's a discussion that should be had at the very beginning when you're framing the entire design of the project. So it shouldn't be something that you do once you've done the installation. I think it presents more challenges after, because there are things you can't change that could have been changed at the very beginning if you include sustainability as the very first thing.
A good proposal would be to tag maintenance to a service. So basically, say company X is being paid per month for the units of electricity used under O&M. So when the system goes down, company X knows it's at a loss if it doesn't go and rectify that system. So it ties them to respond faster.
I think the first thing to keep in mind is that we have to have a paradigm shift. We need to change the focus from procurement of systems to quality service delivery. So right now, if you consider the status quo, systems are procured using a private sector contractor, but then O&M is usually not given the same importance. Now, when you look at a private sector service provider who is providing these systems, the service provider often has the capacity, often has the experience and the competence to make sure that the systems that are installed are able to deliver services over the lifetime of the assets, right? For solar panels, this could be 10 to 15 years. For batteries, this is 5 to 8 years. They've installed these systems. They inherently have the incentives to make sure that they perform well.